Alright, hi, my name is Faith. I'm going to be your nurse. I'm just going to do a physical assessment on you. Can you please tell me your name and date of birth?
Vincent Gennaro, 5/13/02.
Do you have any allergies?
I do not.
Okay. And are you in any pain?
I am not.
Okay, so I pull curtain, and then the first thing I'm going to assess is your skin. Okay, so I don't notice any like skin breakdown or moles, lesions, masses anywhere on your skin. I'm just going to feel your skin. So it's a nice like pink color. Your skin is smooth, and I'm just gonna feel for skin turgor, which it recoils immediately, which is good. There's no odor, no scars anywhere. Yeah. Next is head and neck. So just gonna feel your head. It's symmetric. Shape is round. I don't feel any masses, lesions, or tenderness anywhere. I'm just gonna feel for your lymph nodes next. So first we're gonna start off with pre-auricle, and then we'll go to post-auricle, occipital, submental, and submandibular, tonsillar, superficial cervical, and then we'll go down to deep cervical, and then posterior cervical. Okay, and then I'm just gonna feel for your trachea. I don't feel like any deviation or anything. I'm just gonna push it to the side and have you swallow for me. Okay, I'm gonna have you swallow again. Okay, good. So it's just to feel your thyroid. Yeah. So next I am going to check your eyes. So your eyes are symmetrical. I don't notice any like strabismus or anything. They're aligned. And I'm gonna check your conjunctiva next. So it is pink in both eyes. Sclera is white, and what am I trying to say? Cornea is pink. So next I'm gonna check red reflex. Alright, so just look at me. Okay, good. Alright, so I notice the red reflex is intact, and then I'm gonna have you look at me again. I'm just checking the direct eye test. So okay, so your pupils constrict, and then the other one constricts as well. And then I'm just gonna check corneal as well. So still look at me. I'm just gonna check from the side. Good. Good. Okay. And then I'm just gonna have you look at the pen. I'm just gonna move it towards your nose. Okay, good. And then your eyes accommodate for that as well. And I was also testing convergence there. Next, I'm going to check your ears. So I'm going to palpate the auricle for any masses, lesions, or tenderness, your tragus, and then mastoid, any tenderness?
No.
Okay. So size is like normal. The color is the same as the rest of your body, and they're symmetrical. I don't know if I said aligned already, but they're aligned. Yeah. So next I'm just gonna take a look at your ears. So I don't notice any discharge, any swelling. Sorry, I don't want to like scream in your ear. Your ear canal is pink, tympanic membrane is gray. Yeah, no swelling or drainage. Let's go check the other ear. Same thing on this side. Ear canal is pink. Tympanic membrane is gray. Sorry.
No, you're good.
No drainage, swelling. No odor. Yeah. So I'm just gonna do the whisper test real quick. So I'm gonna have you close the other ear. And then just repeat back what you hear.
CED. EFP.
Okay, good. So then I'm just going to palpate your face. So I'm just feeling frontal, maxillary for any masses, lesions, or tenderness. Yeah. So next I'm just gonna check your lips. I'm checking for any masses, lesions, or inflammation with this as well. So lips, they're pink. Can I have you open your mouth for me? Okay. Do you have your tonsils still? Okay. So tonsils are intact. There's not like swelling or anything. Hard and soft palate is intact as well. Can I have you smile for me? Okay. Teeth are aligned. They're white. They're straight to them. Can you stick out your tongue for me again? Sorry. And then lift up. Okay. And your mouth, your gums are intact as well. There's no like swelling, inflammation. Yeah. Mouth, pink. Everything looks good. There's no like bleeding or anything. So then we'll do nose. So I'm gonna palpate your nose for symmetry, tenderness, and masses. Does it hurt? Okay.
No.
Can I have you look up? Okay. So septum is intact, and then colors with the rest of your body, and then so I'm just gonna test like nasal patency.
Mm-hmm.
So can you just close this nostril and breathe in? Okay, and then the other one. You can breathe, okay?
Yeah.
Okay. No discharge either. And then we will do lungs. So it's symmetric, shape is normal. I don't notice any increased breathing effort. So I'm just going to palpate the posterior of your back 10 times. I'm just palpating for any masses, lesions, or tenderness. Does it hurt at all?
No.
Okay. And then lung expansion. We'll do that. So just breathe in normally, and then breathe in. Okay, good. I'm just gonna take a listen, and then I'm going to listen for 20-30 seconds with each spot. We'll start with the back and then we'll go to the front. Alright, can you just like put your arms out? Thank you. Okay, and then just this side. Okay, so lung sounds are clear in all of the lobes. So next we are going to do cardiac. So I'm just going to have you lay down. I'm just gonna inspect for any lifts or heaves, feel for a thrill. So I'm just gonna put this out first. So I don't notice any lifts or heaves looking at your chest, and then I'm just gonna feel for a thrill, which I don't feel anything, which is good. All right, all of you sit back up. Thanks. And then I'll listen to the 4 valves. Again, 20 to 30 seconds for each valve, and then I'll do both sides of my stethoscope. So the aortic first. Mitral, no, pulmonic. Ready? Yeah. Tricuspid. And then mitral. And then I'll listen again. Okay. S1 and S2 are present. And then again, I'm just gonna inspect your extremities. So skin is pink. There's no like cyanosis or anything. Temperature, skin is warm, smooth. I'm just gonna check capillary refill. So within 3 seconds. And then I'll check pulses too. Okay, +2. And then I don't notice any edema on your upper extremities. Can I just have you take your shoes off so I can check pedal pulses? Okay. All right, pedal pulses are both present as well. And then I'm just gonna feel for any swelling of the legs, which I don't feel any. Okay, good. Pigmentation to pink. I don't know if I said that already, but and then we're gonna do abdomen. So I'm gonna have you lie back down. Okay, so looking at your abdomen, it is flat, non-distended. There's no lesions or scars. So I'm just going to listen 20 to 30 seconds, 3 times in each quadrant. So bowel sounds are present, and then I'm just going to percuss 3 times in each quadrant. Okay, and then I'm just gonna palpate for any masses, lesions, or tenderness. Does it hurt at all?
No.
And while you're here, I'm just gonna do your hips, just assessing like range of motion and stuff. So can I have you just put this leg out, okay? And then put it back in. Can you do the other leg for me? Okay. And then I'm gonna have you lift your knee up if you can, okay? And then move it out. Good. Back down, and then do the same thing with the other knee. Good. And then can you press against my hand? Okay, and then push. Same thing with the other leg. Okay, so strength is intact, +5 for that. Let's see. I'm gonna sit you back up. I'm just gonna be turning around. I'm going to just palpate your spine, just making sure that it's aligned. Okay, good. I don't notice any like deformities or tremors, and it's symmetric. You can turn back around. So again, I'm just gonna check each joint. So TMJ, hold on, I'll do that after. Cervical, I'm just checking like for color too as well, which is normal. Shoulders, elbows, wrists, hand, fingers, that's all good. Hips was good. Knees, and then good. Right. So we will do TMJ first. So I'm just gonna have you clench, and then can you open and move like side to side? Okay. And then press up against my hand. Another one. Okay, good. Shoulders. Can you lift your arms up, and then back behind your back? Good. Put your arms out, press up against my hands, and then push down. Okay, good. And can you like, yeah, perfect. So we did hips, TMJ, elbows, shoulders. Can you shrug? Okay. Okay. Neuro. Can you touch your nose and then press my finger and then back? Good. And then other one. Okay. And then press your thumb to each finger and then back. Good. Bicep patellar reflex. Okay. All right, and then I'm just gonna do your knees. Okay. So reflexes are intact. And then I'm going to do like sharp and dull sensations on your face, hands, and feet. I'll start off with your face first, and you just tell me if it's sharp or soft.
Sharp.
Okay.
Dull. Sharp.
Yeah.
Dull. Sharp.
Okay, good.
Oh no.
I know. Can you grip my hands? Okay. And then we'll do the cranial nerves. So I'm just gonna have you close your eyes, and I'm gonna have you smell something. And you tell me what you're smelling. Yeah. Alright, can you close one eye for me, and you're going to read the chart over there, the one above the red line.
TEFPOTEC.
Okay, and then the other eye backwards.
CETOPFED.
Okay, good. So cranial nerve number 1 and 2 are intact. 3, I'm going to just have you follow the pen light. Don't move your head or anything, just your eyes. Okay. So cranial nerve number 3 is intact. We already did cranial nerve number 4. That was when I shined the pen light in your eyes to make sure that your pupils constricted. And then we'll do number 5 now. I'm just going to have you clench your jaw. Try to open your mouth. Okay. So that's intact. And then we already did cranial nerve number 6. I moved the pen light towards your nose. Cranial nerve number 7, can you just squint well, close your eyes, yeah. And then smile, frown, puff your cheeks. Okay. Number 8, we already did the whisper test. So that's intact. Number 9, can you just open your mouth and say ah? Say ah. Okay. So that's intact as well. Usually I would like perform the gag reflex, but we're not doing that. So, and then you're able to swallow, talk without hoarseness. So cranial nerve number 10 is intact. Can you move your head side to side, up and down? Okay, good. So cranial nerve number 11 is intact. And then the last one would be to stick your tongue out and move it side to side. Okay, so cranial nerve number 12 is intact. I feel like I'm forgetting something. Did I?